You know that feeling, a strange symptom pops up and suddenly your mind starts racing. Is this normal? Is it nothing? Or is this an emergency? Well, today we are cutting right through that anxiety. We're going to give you a clear, expert-backed guide to gynecological symptoms so you can feel confident about what to do next. Okay, let's set the scene. You're at home. You're recovering from some kind of gynecological treatment. You're expecting a little discomfort. That's normal. But then something else creeps in. A little twinge you didn't expect, maybe a bit more bleeding than you thought there'd be. You just have this feeling that something isn't quite right.
And that's when your brain starts spinning, right? Is this serious enough to call someone? Do I need to go to A&E, or am I just being paranoid? Am I going to be wasting a doctor's time? That feeling of uncertainty, that's exactly what we're going to clear up today.
Okay, so to cut through all that noise, we need a voice we can really trust. And that's why all the advice in this explainer comes directly from the Women's Health Clinic, and it's all been medically reviewed by its amazing founder, Dr. Farzana Khan.
Look, Dr. Khan is not just any doctor. We're talking about a leading expert with over 2 decades of experience. From earning her medical degree all the way back in 2003 to now being a key opinion leader who actually trains other clinicians, her entire career has been focused on women's health. So you know the advice we're about to hear is rock solid. Now that we know who's guiding us, let's talk about the emotional side of all this. Because it's never just about the physical symptoms, is it? It's about that deep, real fear of making the wrong decision.
And this quote, this just hits the nail on the head, doesn't it? This comes straight from the clinic's own guidance, and it gets right to the heart of why so many of us hesitate. It's such a common feeling, but it can be a real barrier to getting the care we need when we need it.
So how do we get past that worry? How do we find that clarity? Well, the Women's Health Clinic has created a really simple but incredibly powerful tool. It's a triage system. I want you to think of it like a traffic light for your symptoms, designed to tell you exactly where to go.
And here it is. This slide is your practical roadmap. It breaks it all down so clearly. Red means stop, this is serious, go to A&E now. We're talking about sudden, severe thunderclap pain or really heavy bleeding. Amber is for things that are urgent but not life-threatening, like a suspected UTI or pain that's just not getting better. And green is for those routine things, the questions that can easily be handled with a call or an email to the clinic. See, this is the clarity we've been looking for.
Okay, let's really focus on that red category for a minute, because knowing these red flags, this can literally be life-saving. These are the symptoms where you never, ever just wait and see.
I want you to remember this number. 1. Just 1. It's such a simple number, but in this context, it might be one of the most important things you take away from this whole explainer.
And here's why that number is so crucial. If you are soaking through one large pad in just 1 hour, that is a major red flag for severe bleeding. And if that happens for 2 hours in a row, that's not a wait and see. That is a 999 call. No hesitation.
Pain can be so confusing, can't it? Is this just a normal healing cramp, or is it something way more serious? This slide lays it out perfectly. Recovery cramps, they tend to come and go, kind of like a bad period. But emergency pain, like from a twisted ovary, that's a whole different beast. It hits you like a truck. Suddenly, it's constant, it's severe, and you might even feel sick to your stomach. That's your body screaming that something is very wrong. Now, for any postmenopausal women listening, there is one simple, absolute, non-negotiable rule. Any bleeding is a red flag. I don't care if it's a single spot. It's not usually an A&E emergency, but it absolutely requires an urgent doctor's appointment. Do not ignore it, and please do not wait to see if it happens again. All right. So you've got the facts, you have the framework. But now let's talk about the most powerful tool you have in your arsenal, the one that's already built right in, your own intuition. I absolutely love this quote. It reframes everything. Your feeling isn't just anxiety or you overreacting. It's data. That gut feeling, that little voice saying something is wrong, that is valuable clinical information. Your instinct matters a lot. So let's just bust some of these myths that hold us back, shall we? That voice in your head that says, I don't want to be a bother, you're not. Post-treatment support is part of the deal. Your clinic wants to hear from you. Or how about if it were really serious, the pain would be unbearable? Nope. Serious problems can start small. And that temptation to just wait for your next checkup, if a symptom is new or getting worse, you need to call sooner, period.
So really, the whole point of this explainer comes down to this. Knowledge is absolutely power, but it's self-advocacy that puts that power into action. This framework gives you the tools to finally understand the signals your body is sending you. The only real question left is the one right here on the screen. You are your body's best advocate. So, are you listening?